Hello, you guys. Welcome to our presentation, Dosage Calculations, D over H times Q, and Introduction to Dimensional Analysis, presented by Apex Nursing Academy. So, today we're going to practice our D over H times Q problems, and we're also going to introduce how to set up a dimensional analysis problem. So, if this is your first time with us in our dosage calculation series, you can go back to our very first lecture in the dosage calculation where we break down D over H times Q. Now we're going to move on to dimensional analysis. We'll still practice some D over H times Q and we'll introduce dimensional analysis problems, okay? So get your paper, pencil, get ready to practice with us and learn dimensional analysis. All right, you guys, we are going to review some dosage calculation problems. We're going to do a few D over H times Q, and then I'm going to introduce dimensional analysis to you guys. So a dimensional analysis is another option for those of you who don't want to use formulas or struggling with using formulas. I know sometimes it can be hard trying to memorize and keep up with which formula to use. So dimensional analysis is a way that you can still work out your problem without memorizing the formula. You do need to know conversions with dimensional analysis, but it will save you some time from trying to write down a bunch of formulas when you're taking your test and not forgetting and having to worry about not forgetting formulas. So we'll do some D over H times Q review. And again, if you don't know D over H times Q, you can go back to the beginning of this lecture series, Dosage Calculations, and you can start from the beginning where I break down D over H times Q and what that means. So we will do some practice we'll do a couple of D over H times Q, and then I will introduce you to dimensional analysis. So follow along with me, work out these problems. Practice. The more you do dosage calculations, the better you will get at doing dosage calculations. Okay? So let's just jump right into it. A patient with diabetes has an order for 40 units of NPH insulin to be given subcutaneously each morning. The vial contains 100 units per 1 milliliter. How much insulin must be given? So let's get our D over H times Q values. Remember, D is just our order. What has been ordered? 40 units. 40 units. What do we have on hand? Well, we have a vial that contains 100 units per milliliter. The quantity is 1 milliliter. Let's check our units of measurement here. Units. We're matched. We can plug in our numbers and calculate. So 40 units, that's our D divided by 100 units, times our quantity is 1 milliliter. 40 divided by 100 is 4. Our units cancel out, times 1 milliliter. 4 times 1 milliliter is 4 milliliters. So how much insulin must be given? 4 milliliters. And here's a tip, especially when you're dealing with insulin, but really any dosage calculation problem. If you get an answer that is just sounds like it's not right, like it's way too much or way too little, go back and recheck. And that's just a good tip for all dosage calculation problems, is to double check your work. We're talking about giving some insulin to this patient. If we came up with something like 400 milliliters, you know you're not going to give 400 milliliters of insulin. It just doesn't sound right. So go back and double check your work. If something looks off, if it looks like, that's not a reasonable amount that I would give, go back and give it a second look just to make sure that you haven't made just a small error in your calculations. So let's keep moving. As part of preoperative care, the surgeon has ordered atropine 0.2 milligram IM. The multi-dose vial reads 1 milliliter equals 0.1 milligram. How many milliliters will be given to this patient? Let's plug in our numbers. What's been ordered? 0.2 milligram. What do we have? We have 0.1 milligram in 1 milliliter. Okay? Don't let how they present information to you throw you off. Look for your values when you're doing your D over H times Q or whatever problem you're doing. Look for your values that you need to work with out of the problem. If it's something that does not pertain to what you need to work with, don't put it in your problem. Just get the value that you need. Let's check our units of measurements here. Milligram to milligram. We don't have to convert anything that matches. Let's plug in our numbers and calculate. So we have 0.2 milligram. We have 0.1 milligram times our quantity is 1 milliliter. 0.2 divided by 0.1 is 2. Our milligram cancel out, times 1 milliliter. 2 times 1 is 2 milliliters. Right? So how many milliliters will be given to this patient? 2 milliliters. If you have any questions, any comments, put it in the comment section. I will see it and I will respond. We are moving right along. Our next problem says you are preparing to give metoprolol 50 milligrams orally twice daily for a patient with hypertension. The pharmacy has provided you with scored tablets of 100 milligram each. How many tablets of this drug should you give to the patient? Let's pull out what we need. What's been ordered? 50 milligrams. 50 milligrams of metoprolol. What do we have on hand? We have 100 milligram tablets. So one tab is 100 milligram. Check our units of measurement. Milligram to milligram. They match. We don't have to convert anything. We can plug in our numbers. We can calculate. And we can get to our answer. 50 milligrams. 100 milligram. Times our quantity is 1 tab. 50 divided by 100 is 0.5. Milligrams have canceled out times 1 tab. Right? 0.5 tab. In other words, half a tablet. And if you can see in the problem, it does tell us that the pharmacy gives us scored tablets of 100 milligram each. And scored just means that it's marked where that you can cut the tablet in half, break it in half. So we have this 100 milligram tablet and we can break it. It's scored. We want to give half a tablet and that will equal 50 milligram. Now here's another tip. You may be taking your test in class or in your class and you may say, hey, I see that the order is 50 milligrams. The tablet is 100 milligram. 50 is half of 100. I just break the tablet. Give half a tablet. You do the problem in your head mentally, it's easy enough, true, but for math, I would advise that you always write out your problem, even if it's something simple that you can figure out in your head really quick. Write it down just to avoid mental errors, and that you can still double check yourself and make sure that you're getting the correct answer. Even if it seems like it's something simple like this, we know you can, half of 100 is 50. So if I just need 50 milligrams, I can give half of 100 milligram pill. But for test purposes, write your problems out, work them, double check, and select the correct answer, okay? Or write, if you're not selecting, write in the correct answer. You don't want to get problems wrong just because you rush through or something, just a mental error in your head, okay? Moving on to our next problem, it says a healthcare provider orders clindamycin 600 milligrams POQID. Directions for mixing are to add 100 milliliters of water and shake vigorously. Each 2.5 milliliter will contain 100 milligram of clindamycin. How many teaspoons of clindamycin will you give? Well, let's see. Let's plug in our numbers. D, what do we have ordered? 600 milligram. What do we have on hand? We have 100 milligram. Quantity is 2.5 milliliters. We got milligram to milligram. We're matching. No need to convert anything. Let's plug in our units of measurement here. 600 milligrams over 100 milligrams. This is our D over H times our quantity is 2.5 milliliters. 600 divided by 100 is 6. Milligrams cancel out, times 2.5 milliliter. 6 times 2.5 is 15 milliliter. So 15 milliliter is how much we're going to give. But if you notice, our question says how many teaspoons. So we have to figure out teaspoons from 15 milliliters. And I think that I can use that to introduce dimensional analysis. Remember, our answer here is 15 milliliters, but we need to convert, we need to get our answer to teaspoons. So I'm going to do that part in dimensional analysis just to show you how dimensional analysis set up. So I'm going to erase all of this. Remember, our 15 milliliters is what we got for our answer. I'm going to erase. So dimensional analysis is just using an equation to get to the answer. And you're gonna build your equation. You start off with the measure that you're looking for, and then you'll start building your equation, and you're going to just keep building your equation until you get all the units that you get all the units that you're working with cancel out till you get down to just the unit that you need in the equation. Then you can solve the equation and come out with your answer. So I'll show you that using the other part of this problem. Remember, we had 15 milliliters, and it asks us how many teaspoons of clindamycin will we give. So remember, with dimensional analysis, when you're setting up your equation, you want to start with the unit of measure that you need. So we need teaspoon. So we're going to start with teaspoon, and we're going to put 1 teaspoon is equal to what? 5 milliliters. Now, as I said, dimensional analysis doesn't use formulas, but you do need to know your conversions, and your instructor may or may not give you conversions. When I test, I don't give a conversion list. So I tell students that you need to commit those conversions to memory, and that's always good. Those you can commit to memory, and that will help you be able to go through the dimensional analysis equations and set up your equation. So 1 teaspoon equals 5 milliliters. That is a common one that you should commit that to memory. So 1 teaspoon equals 5 milliliters. So now we have introduced teaspoons into our equation, and we have milliliters into our equation. We're looking for teaspoons, so we got to get milliliters out. Now what you do is, to set up your next part, is you want to let the denominator guide you into setting up the next part. So this is the denominator. Remember the number on the bottom. So we have milliliter for our unit of measurement in the denominator. So whatever is in the denominator, that is what guides you to the numerator for your next set. So milliliters is in the denominator here. We're going to have milliliters in the numerator next. Okay, so we have milliliters in our problem. In our answer, remember we had 15 milliliters. So let me add that in there. 15 milliliters. Okay, 15 milliliters, and now we're able to cancel out milliliters because we have milliliters on top and milliliters on bottom. That cancels out. It leaves us with teaspoons, and that's what we need. So we don't have to try to set up another part of this equation. We can move on to solving this equation. So and for people who need to see a number, you can put a 1 here. It does not hurt anything. Remember, a whole number as a fraction is the whole number over 1. If you need to see a number there, go ahead and put the 1. Don't fret and stress over things that you don't have to fret and stress over. If you need to see that 1 there, put it there. So once you have your equation in here, you want to multiply across on top and multiply across on bottom. So 1 times 15 is 15, and 5 times 1 is 5. Then you just keep dividing, keep working your equation till you get to your final answer. 15 divided by 5 is 3. So now we have 3 teaspoons. 3 teaspoons is our final answer. So when he asks us how many teaspoons according to Monson, when we give, we're going to give 3 teaspoons. So I did that last part in dimensional analysis so that you can see kind of how you set up dimensional analysis and what it's all about. So we'll do another problem where we won't use D over H times Q, but we'll use dimensional analysis. Okay, so let's see. An order reads to give erythromycin 250 milligrams. You have on hand 0.5 gram tablets. How many tablets will you give? So remember, for dimensional analysis, you want to start out with the unit of measurement that you need. So we need tablets, so we're going to start out with tablets. We're going to put tab here, and we're going to get right to our tablets. So 1 tab is 0.5 gram. We get that from the problem, right? 1 tab is 0.5 gram. So now we have our first part set up. We can use the denominator to guide us into numerator, right? So we have gram here. We need gram in numerator. So we want to get to milligrams is what we want to get to. So what we'll do is get our gram out to cancel. So we need 1 gram here is equal to 1,000 milligram. You see, that's what is going to get us to milligram. So now our grams can cancel out, and our milligram now is in the denominator, and we can get it to cancel out because we want to get to tab, remember? So we need to cancel out milligrams, so we're going to keep going, and we're going to get our milligrams on top, which we'll use from our problem, 250 milligram. Now we can cancel out milligrams. Our grams cancel, and that leaves tab. So now we can move on to calculation. We don't have anything else to cancel out in our units of measurement. We only have the tab, which is what we're looking for. And remember, this is all multiplication between here. So we're going to multiply on the top. We're going to multiply on the bottom, divide that out to get to our answer. So I may have to move up a little bit just to get under here. So 1 times 1 is 1, and 1 times 250 is 250. Then we're going to multiply the bottom. 0.5 times 1,000. 0.5 times 1,000 is 500. And we're going to keep multiplying. Remember, put your 1 there if you need to see it. 500 times 1 is 500. So now we're getting somewhere. 250 divided by 500 is 0.5, and we can put our unit of measurement 0.5 tab. So how many tab or tabs will we give? We will give 0.5 tab, half a tablet. That is your dimensional analysis. Now you still could have went through this problem and did your D over H times Q. But as I said, as you advance in your calculation problems, you're going to be having a lot of formulas to use. Dimensional analysis gives you an option to calculate the problem without using formulas, if that's something that you struggle with. Again, if you can use formulas and you're not struggling with using formulas and remembering formulas, keep doing what works for you. This is another option for people who are struggling with remembering those formulas. You can use dimensional analysis. So our next lecture, we will do some more, maybe 1 or 2 problems on D over H times Q, just to keep it fresh in our minds, and we'll do like a good little amount of dimensional analysis problems. Again, you can go back to the beginning of our dosage calculation series and start there to learn about D over H times Q, and then we just build on after that. So you guys keep practicing. If you have any questions or comments, leave it in the comment section and I will respond. Until next time, have a good day.